So it's time now to just jump back into cases with part 2. Our first case is Sunny, and Sunny's a lovely Cocker Spaniel, and he's 13 years old, and he's come today to us for dental cleaning, radiographs, and likely some extractions. What's relevant in Sunny's history is that he has stress-induced pancreatitis, and it flares anytime he's stressed. So that's travel, that's new people in the home, it's a change in diet, it's trips in the car to the veterinary office. And so we're worried, number one, that we may have his pancreatitis flare in the post-operative, post-anesthetic period in those first few days after he goes home. And that's always a problem because he ends up back in the hospital on fluids. It's so severe that he's been hospitalized several times for it when his pancreatitis flares up. The other issue is that Sunny has ongoing trouble with gastroesophageal acid reflux. He's been on famotidine for quite a while for his acid reflux. So we have to put some thought to how we can decrease the stress in that whole peri-anesthetic period. So we want to choose when Sunny arrives at the clinic, how long he stays with his human companion to decrease that stress, how quickly after anesthesia and his procedure that we're going to reunite Sunny with his human companion just to try and decrease the stress of the day and hopefully avoid the pancreatitis. The owner is very, very aware that this pancreatitis could flare, but we're going to go and make some adjustments to the flow of our day to accommodate Sunny's propensity to become very stressed and then have his pancreatitis reoccur. We also have to think a little bit about Sunny's gastroesophageal reflux and how we're going to manage it the day that he has anesthesia. Gastroesophageal acid reflux during anesthesia is actually associated with 45 to 65% of cases of esophageal stricture in dogs. And it actually is the most common cause of esophagitis and stricture formation in dogs is this acid reflux during the peri-anesthetic period. Well, we're lucky enough now, there weren't guidelines previously, but we're lucky enough now to have a consensus statement from the American College of Veterinary Internal Medicine, and it was published in 2018 in the Journal of Veterinary Internal Medicine, and it recommends that we treat dogs a little bit differently than we traditionally have. Basically, what they found was almost no benefit to H2 blockers. So famotidine has almost no benefit to dogs on an ongoing basis or even in the peri-anesthetic period. And what this document actually has recommended for control of gastric pH. Now, remember, the proton pump inhibitor, so we're talking about omeprazole, and the recommendation here at 1 mg per kg, 12 to 18 hours prior to the procedure, and that dose repeated again 1 to 2 hours prior to the procedure. And in the whole document, there's some other things that they talk about as far as treating patients with gastroesophageal reflux. But this is what's recommended now, evidence-based, to help decrease the acid in the gastric contents, so we're increasing pH. Remember that this doesn't decrease the amount of gastric reflux that may occur, it only limits the injury to the esophagus by increasing the pH of the refluxate. Cisapride or metoclopramide are also recommended to help reduce the amount of contents in the stomach so that if patients are going to reflux, perhaps it will reduce the volume of that reflux. And the timing of the cisapride or metoclopramide, cisapride seems to work a little bit better than metoclopramide does, but if all we have is metoclopramide available to us, well, that's okay. And the timing is about 1 to 2 hours prior to anesthesia induction, and that seems to also be beneficial. So we have some extra instructions for Sunny's owners. They go, do we want them to give the famotidine? Well, that's questionable. I don't change protocols like that because that is between the referring doctor and the client and the patient before they come to me. And so I'll just tell the client, in addition to the famotidine, even though the consensus statement now from the Internal Medicine College says, well, it's probably not beneficial to have them on famotidine. You go, no, I'm not going to take him off of it because that's a regular medication. He's used to taking it. Someone else has prescribed it. I'm not going to make a change in that. But I'm going to just add the omeprazole to the protocol and say, go ahead and give this the night before. Go ahead and give this the morning of the procedure.